this is time for you. Tell me about you and tell me about how you feel and what do you want to achieve, and make it real, because everything will take time. And just like with the painkiller, I was thinking about it today because sometimes these questions come up and I was like, I want to have a good example to make sure I'm making sense. But a lot of the times we have this thing about, oh, I went for acupuncture once and it didn't work. Okay, so if you had a pain in your back and you took a painkiller yesterday and it worked for a while, but then today the pain is back, do you say that that painkiller didn't work?
Welcome back to my channel. For those of you that are new here, I'm Dr. Ami Patel, pharmacist and fellow sister, and today I'm excited to have a special guest, Sandro Graca. Thank you so much, Sandro, for being here.
Thank you for the opportunity. It's a pleasure to reach out to your community as well. Thank you.
Yeah, thank you. Thank you. I'm really excited. And you're the second male guest that I've had because, most of the people I talk to are women that have PCOS that have used that as, a passion and made it into, I guess, similar to like my story, like made it into raising awareness about it more for like personal reasons. I'm really excited to have you on. Sandro is an acupuncturist, lecturer, and researcher, a fellow of the American Board of Oriental Reproductive Medicine, and one of the directors at Evidence Based Acupuncture. He completed his Master's of Science focusing on acupuncture for PCOS and is one of the researchers on the Cochrane Review Group for acupuncture for IVF. So this is really exciting to talk about evidence-based acupuncture. So like I was mentioning, we don't really see that many men that are interested in women's health. So why don't you tell us a little bit about what got you interested in women's health and PCOS as your specialty for acupuncture?
Yeah, I never actually really think about that because to me, it's just like being part of the community and I get to talk to you all and it's really, really good. And this is not just because the cliche, but I think that it's really important, the work that you do. And not only because of your knowledge, but actually sharing your stories as well. It just means that more people can come forward as well. So thank you so much for that.
Thank you. Thank you.
From seeing that, and honestly, from seeing that in the clinic, a lot of the times we have people coming into the clinic that it's the first time that they're actually openly talking about stuff that, no disrespect to other clinicians that might have just told them, go on the pill, it's nothing, don't worry about it. And then 5-10 years down the line, there they are with some issues. So again, for the work that you do, not just because of your knowledge and your expertise, but in terms of sharing your stories, I think that it's really, really important. I don't have a PCOS story to share. And my PCOS story, I guess, how did it become so much more focused on PCOS was mainly because of the masters, really. At that stage, it was pretty much just to do with menstrual health, reproductive health. I was already involved in work with fertility clinics, even with the being a fellow of the ABORM as well. In terms of, so originally when I started, so when I finished my licentiate here in Ireland, as you can imagine, opening your clinic, I would see a lot of pain. Like pain would be the most common complaint that I would see in the clinic. And just today, as I was getting ready for your tough questions, I was thinking, how did this change? Was there something there? And now with hindsight, I can actually look back and think, you know what, there was though. And I always say that the seed was planted after, because it was around 2 years after graduating was when I had the chance of going to Beijing University.
Mm-hmm.
And I always say that it was there, and really, like, it was really there that I got really into menstrual health mainly, and that was really exciting for me. But before, I can now look back and think, yeah, there was a little bit of, a lot of the times you would get women coming into the clinic that were pregnant and saying, oh, my consultant told me to get acupuncture, or my GP or my MD, as you would call it there, my cycle is irregular. They heard about acupuncture. Can you help? So there was that little bit even before Beijing, but for sure, when I spent time there in Beijing University, there were two, like one professor and one doctor in particular, Dr. Ma. I wrote about her recently for the blog for the college, and I was just fascinated. What really, really got me to explore more about women's health was, I know it's going to sound like a cliche, but she would get in the room and start talking to women. It was like there was this aura where people just felt like opening up to her, and she would be so kind, and so there was like that connection, and I was like, that is pretty cool. I want to know how you do that, right? And yeah, and look, I'm a big nerd and everything, so when you start talking about hormones and how everything influences one another, it just kind of went from there. But to be honest, yeah, from there, from Beijing, I got really interested. I'm always studying. So I got to study with Johnny White and Jane Littleton. It's a big pleasure that I actually got to meet her and get to know her well, and everything. I wouldn't be here if it wasn't for her and her teachings. And yeah, just continued. It's going as far as even, going for the ABORM and doing the exam and then doing the master's.
Oh, awesome. Well, I think I can speak on behalf of the PCOS community to say thank you, for the work you're doing. We definitely need more research on, PCOS and other alternatives for people where, Western medicine may not be the option that they want to choose to manage their PCOS.
Mm-hmm. Yeah, what I find really fascinating, and it's really interesting, again, the path that the master's got me into, because when I say it was really because of the master's, it was during the first semester I had to do a literature review. And it was one of the lecturers said, well, I know you're big into reproductive health, just pick something that you're really passionate about, because if you're going to spend these years for the master's degree learning about this, pick something that you really love. And that was it. That was the first literature review I did on PCOS, or acupuncture for PCOS. And I was really fascinated. And I did something really geeky. I even, around this time actually of the year, so it was towards the end of the year, and I got on the email, and I was like really like a little kid, and emailing Professor Elizabeth Stenner Victorian and going, I'm doing this literature review and your studies are coming up all the time, and I'm really fascinated about acupuncture for PCOS. So it really got me, involved in it, and I really like it. And a little bit about what I do, and it's not just because of the research itself, but the fact that what I'm trying to do, moving on from the master's degree to the PhD, is always focusing on the patient and being very patient-centered. I can only go back to that time in Beijing University and just see that it's about the person in the room, right? And then working with the person in the room, not just publishing more stuff and putting more, no disrespect, we need those papers, right? But it's always, getting the people with knowledge like yourself, getting the patients involved, women, people that had the experience with PCOS, being involved in the research as well, and designing something that suits everyone. That's really my passion.
Yeah, exactly. And you want the research to be applicable and,
Yeah.
have patients get results. So for people that, may not know, can you elaborate a little bit on what the benefits of acupuncture are?
So if you talk about PCOS more specifically, like that's really around 2000 was when the first paper was published. And as you know, the history of PCOS is not really that old anyway, because we can go back to 1935 and it was called something else and so on. But in 2000 was like the first landmark that you can think about acupuncture for PCOS. And that was using acupuncture points and electroacupuncture as well. And it was focusing a lot, and during those first few years, and you still see a little bit of that, focusing on promoting ovulation. Reason being that you would have, if someone is not ovulating, not menstruating at all, well, you have to start somewhere, right? So that was kind of like the first focus. And that was, in very broad terms, without being too nerdy, the focus was really on the lower abdomen. And just the points were there, even the electroacupuncture as well. And you're really trying to stimulate as much blood flow in the area as possible. And that was found to have that impact of, if you then get the person to ovulate, you're going to, you're almost like kickstarting the hormones to the next stage will be then 14 days or so later, there's going to be a bleed. And then you're hoping that the cycle will bit by bit just get back to normal. In reality, in clinic, you don't really see it going back to normal straight away.
Mm.
But what I remember seeing from the very beginning was, you'd have the 40 to 50-day cycles, that the next one would be 30 to 40 something, and the next one will be 30 something. And then little by little, you would get closer to that magic, 27 to 30-day mark. And that was really what was found to be like the big, I suppose, the first landmark in terms of acupuncture for PCOS. What you have also to realize, and I know you know this, but even for the community listening to this, is that someone coming into the clinic doesn't just have one problem.
Yeah.
And specifically with PCOS, there's a lot of other things. But if you're talking in general, there could be other things that that person could be coming in: fatigue, issues with obesity, not being able to lose weight, and not sleeping well. It could be loads of other things. And one of those that we found a lot, and it's part of the reason why we always got involved with the fertility side of things, is that people are stressed. They You've seen recently the paper showing that it's taking them 2 years or more before getting a diagnosis, 2 to 3 medical practitioners before getting a diagnosis. And I can imagine that this is probably not just for PCOS, for other things as well. A lot of the times we just go with, maybe I'll be better tomorrow. And then I'm not better tomorrow. And then, with pain is the same thing. You put up with it for so long, and then you go when it's really, really bad, right? So that aspect of relaxing, and things like people saying that they go for acupuncture, they feel better after. Yeah, when was the last time that you were able to be 30 minutes to 40 minutes or 45 minutes in the room and nice and calm? Someone is actually asking you, how are you? Right? And you feel calm and relaxed. So there's all that impact that we know from acupuncture in terms of hormones and in terms of the sympathetic and parasympathetic nervous system as well. All of that, then it becomes more about knowing which tools to use for the person in front of you. And almost like, it's a bit like the Christmas tree lights. Where do you start? Right? Like, it's all tangled up, and you can't just go there and not have a plan. So you kind of have to have a plan with the person in front of you. And yeah, in terms of PCOS, definitely the first impact, or the first big thing, was to do with ovulation. Now we see a lot of other things. For example, we had one recently, again, from Professor Elizabeth Senator Victorian, helping with electroacupuncture and simulating and helping to get that first step towards women actually getting the metabolism right and starting to lose weight, because for some, obesity is an issue with PCOS, not for all of them.
Mhm.
The impact that it has even on metformin. We have this all the time. People start taking metformin, and then they feel that they're not that great in their tummy, and they're not as hungry anymore. It's affecting them. Some of them even get nausea. Working alongside that, right? So it's fascinating, and it's really about picking the right time and the right tools to use for the person in front of you.
That makes sense. So it could be, depending on the patient, it could be like, helping with ovulation or weight loss,
Yeah.
or, stress relief, like you said. Okay, that's good to
Yeah.
know. So I know it's like with acupuncture, it's more like Chinese medicine based. And with that, I know sometimes, you can take like Chinese herbs as well. So
Yeah.
can acupuncture be done alone, or do you have to do it together? And how does that play a role with, like, if someone's going through any fertility treatment?
Yes, that's a very good point. Yeah. So the answer to that is yes, and sometimes no, it doesn't have to be done together. Yes, it can be done alone. Um, so here's a scenario. So if someone was to come to me today and say, hey, I've just been to the fertility clinic, I'm going to start treatment on the next cycle. They told me to get acupuncture, or even if they, I just think it would be good to have acupuncture. Can you help me? I would not give herbs to that person.
Mhm.
Okay. They are already going to their fertility treatment. They will have a plan. They will have a structure. We know when we talk about how acupuncture fits in within that care. So everyone knows what's going to happen. If someone was coming to me and say, hey, I wanted to go to the fertility clinic, but as a matter of fact, I can't even remember when my last bleed was. So, my periods are all over the place. I really want to go there, but they're saying that they want to see me when I bleed so they can do a scan. I'd be like, yeah, okay, here's what we're going to do. And at that point, I would most definitely be talking about acupuncture and herbs for sure.
Okay, that makes sense. So I know like in America as well, they say that, if someone is going through IUI or IVF to not be on herbs, but some providers are okay with continuing acupuncture. So that makes sense.
Mhm.
So once again, patient specific, it depends on the situation.
I think it's only fair as well. Like, so imagine, I always say this to my patients in the clinic. So put yourself in the other shoes. So you're the consultant in the IVF clinic. You know what the plan is going to be. You know what dosages you are going to give to this person. And then all of a sudden they're taking all of the other things. And by the way, this doesn't even have to be just herbs, right? It could be even with all the supplements and
Yeah.
vitamins and everything, right?
Mhm.
How would that be for you? How do you work then? What if, let's just, and I say this all, so give you a very good example. One of our most recent pregnancies in the clinic is actually someone who is a GP or an MD, as you would know it, right? General practitioner. And this was a conversation that we had. And I said to her, so here's the thing, I know you were taking the herbs before, but I just want you to not take them now that you're going to the IVF clinic. And she's like, but I was so good when I was taking them. I said, yeah, but that was to bring about the cycle and for you to have a more normal and regular menstrual cycle. Now you got there, you're continuing with the acupuncture. Now I want to see what they're going to give you in terms of medication, and then we'll work with that. Because remember, the acupuncture is not adding anything to your body,
Right, right, right.
right? But the moment that you start saying, oh no, it's wintertime, so take more vitamin D, or it's take more of this, or take more of the herbs, how would you feel if you were the consultant and that patient would come into your clinic and say, hey, by the way, my acupuncturist told me to take more of the vitamin D? You'd go like, why? We designed the plan.
Yeah.
We knew what we were going to do. Why is this changing now?
Yeah, and also you may not know what actually worked then if you're doing a lot of different things at the
Yeah.
same time.
And what if it does work?
Yeah.
Right? Like, so one of the examples I always give is that point before. So you're going through the treatment with IVF and you're getting to the point where you're going to get your egg retrieval.
Mm,
What if you start doing something that is really, really good and works really, really well, but you don't tell anyone, or it's kind of like outside of the plan? And instead of having like a few of those eggs there ready to be collected, you now have double of them. That's not what you want,
yeah.
right? So imagine if it actually does work. I'm not saying that it's negative and it's going to interfere. Don't think of it that way. Think about the positive as well. What if it does all that good thing and then you're actually getting in the way because it's too much,
Yeah.
right? You don't go to the gym and start pulling 160 like straight away. You start little by little and progressively, and you need to know what you're doing. It can't be, throw the kitchen sink at it and hope for the best.
It's true. That's true. No, I think I know when with women that have PCOS and if they're trying to conceive and they've already tried, then I think sometimes, out of desperation or time, if
Yeah,
time is the issue, then they kind of just want to do everything at once. But
yeah,
it's a good point. Sometimes you just have to take it slow and, make sure all your healthcare providers are aware of everything you're doing.
yeah, yeah. Like for me, honestly, in terms of treating someone with PCOS in the clinic, one of the things that I started seeing, and you get this in literature all the time, but one of the things I started seeing in my clinic, and I was lucky enough, again, remember the fact of studying all the time and being in contact, even with everything that was happening there in the US as well. And it just helps to be aware of this. I started to notice that, this is going to sound big-headed, but when you're treating someone in the clinic, if they're not menstruating, obviously it's going to be, how do you know when they're ovulating? So
Right.
how are they timing in terms of trying naturally, right? And it was this thing that once you get like those one or two cycles out of the way, it was almost like it's relatively easy. I know this is going to sound, I'm sorry, it's going to sound really big-headed that, yeah, do one or two cycles and then you get pregnant. But it was a little bit like that, it wasn't so much that the issue was for them to get pregnant. What I started to notice, and what really got me fascinated and in depth to go into then doing the masters and really focusing on PCOS, was that wasn't the end of it. Getting pregnant that's okay. You have your positive pregnancy test. How many of those get to 12 weeks?
Oh yeah.
How many of those
Different
actually have
conversation. Yeah.
yeah, a healthy pregnancy? It was really, so I'm originally from Portugal, so I'm trying not to move my hands too much, but I have Latino DNA. I'm there's fire here. And it was really emotional for me to see these women then coming in after being so happy within those first few weeks of pregnancy, then getting towards halfway point or more and having to deal with gestational diabetes and being told that, the baby's too big, we won't be able to do a natural delivery because of this, because of that. And then, as you know, the issues even after, PCOS doesn't just go away when you get to menopause. There's all the other cardiometabolic risks as well. And I was like, and nobody, it's not that nobody was doing anything about it. To me, it just sounded like the focus was just too much on the getting pregnant.
Yeah.
And I just wanted to give it a little bit more attention to, well, what if instead of just focusing on the getting pregnant, you also think about you during the pregnancy, that baby, think about the delivery. How are you planning that delivery to be?
Right. No.
And for the future as well.
No, that's a good point. And I definitely agree. I mean, that's one of the things I'm starting to talk more about on my page as well, like, gestational diabetes and just like increasing awareness that unfortunately getting pregnant is really hard, but that's just step one. And like you said, there's other
Mm,
complications during pregnancy and after pregnancy that also have to be dealt with for
yeah,
sure.
yeah.
I know you mentioned one of the landmark studies, but is there any other evidence that shows benefits of like acupuncture for PCOS and or fertility?
Yeah, so we have a lot. Like the main thing, to be honest, like if you were to take like the one big thing that we know now that we didn't like 8 to 10 years ago, is actually that dosage matters. Dosage matters a lot. And this is one of the points about, going back to the herbal medicine and, adding herbs to the treatment. Sometimes it does help because and you're doing a little bit every day along with your acupuncture treatment. So one of the things that is quite evident now, both for the fertility side of things, but also involved in things even with PCOS, even when women are then taking other medication, like for example, metformin alongside it, is that dosage matters. And this idea that going for acupuncture once a week or once every 2 weeks, that is just not enough. So that is a big, big deal, because now we can actually adjust and work with the dosages and be more productive with our treatment, right? And uh, yeah, you can't take it away from the fact that yes, electroacupuncture, especially around the belly button area, the lower abdomen, makes a big, big difference. Other points, in terms of moving blood, all the hormones that we can actually affect with other points along the body, that's really, really important. But I think that, yeah, if I was going to take like the big thing that we know now and that we can adjust, is that dosage matters. And we've seen this from recent studies, even with fertility, and looking at the people that were getting 3 or more treatments before the egg collection were actually getting more success than the ones that were just getting random treatments every once in a while. We knew this actually from work from colleagues from the ABORM, and looking at that sweet spot, like the 6 to 8 treatments up to or before the egg collection as well. And yeah, with PCOS, think about it. A lot of the times you're seeing these people in the clinic, and to a certain level, some more, some less, there's going to be that imbalance with the metabolic rate. Something is just not, it being more because of the hormones, it being more because of, actually weight, and they just can't shift the weight. There's going to be an impact on the metabolic rate. And if you think about it, how would you be able to impact the metabolism with something that you do once a week?
Yeah.
You would a little bit, but if you can then, and you see that from the studies, and it's something that I'm really passionate about, is that translation from, paper and what the study says, and then bringing that to the clinic, is that, yeah, having the acupuncture once a week, that might not be enough for these specific patients.
Hmm. That's like a new evidence that you were saying?
Yeah, more in the last, especially in the last 5 years or so, you've seen a lot, and driven by, particularly with the fertility side of things, but then that started to kind of creep into the PCOS world as well, and seeing that, yeah, a lot of the times you see these studies and you see the impact of acupuncture for, people with PCOS, but you're also seeing that they're getting 2 or 3 treatments a week rather than just one a week.
So by dosage, you mean like frequency of acupuncture?
Yeah. So dosage meaning some of the points, obviously, and also the frequency. So how many times we say dosage, because we don't want to be, it's not really, it can't be just about the points, because everyone is different. You can have someone, lean PCOS to someone who is, their BMI is 25 or over, and that's going to be a different treatment for those two people, right? So in terms of dosage, it means, yeah, some of the points for sure, but also how many times they're getting their treatment as well. So how many, really being on that window of 2 to 3 treatments a week,
Mm.
being that sweet spot for someone, especially at the start, before their cycle is more regular.
Okay, makes sense, makes
Okay.
sense. So, say somebody isn't ready for fertility, but they have other symptoms of PCOS that they need help with, like hair loss or unwanted facial hair growth or acne. Can acupuncture help with any of those things?
Yeah, so for those particular cases, then when you get to that point where you have some sort of, like, you're going around and cleaning up the house, right? So you've done, cycle is more regular, or now they're taking some sort of medication for something. That's fine, you can work with that, and then you're starting to talk about more specific hormones, right? And I can tell you now that it is really, really difficult to treat anything to do with hair loss. It is really, really the same way that it is even with excess hair as well. Like, you see, like, the recommendation for excess hair being still the laser. And to be honest, I can't say to someone in the clinic, yeah, come for acupuncture 3 times a week and we're going to sort that out. Maybe, but it's going to take a long, long time, right? So I can deal with the fact that someone would say, okay, I'm going to take something because it's going to help me with the hormone balance at some level, and then I'm going to use the acupuncture to help with that. Again, one easy example is the example with metformin, where, as you know, for some people, taking it first thing might be a bit of an impact. Acupuncture can be used to help with the nausea, to help with all the other symptoms around that. But yes, definitely, when you start talking about more specific hormones, for sure, we have now way more knowledge about what, acupuncture point specificity does, and what we can do with the points, and what we can do with the point combinations. So if you have someone coming in and knowing for sure that this is the main symptom and they need to look at, address this one right now, that's perfect. Yeah, we can work with the acupuncture points around that. For something like that, hormone related, and again, thinking about hair and hair loss, skin as well, I would say that definitely acupuncture and herbs.
Hmm. Okay,
Yeah.
makes sense. But also, like, I mean, it takes time, like you said, but if
Mm,
acupuncture helps with getting the hormones balanced, then in turn, that will ultimately help with the symptoms too,
yeah,
right?
for sure. Yeah. No, listen, I know every
Mhm.
once in a while, this is why I love the interviews and the chat, and talking to someone and getting the questions from the other side as well. And lecturing is the same thing, because then I was saying that, and then when you said it, I was like, oh, I don't want to sound like, oh, it takes time, and this is a treatment that takes time. Everything takes time. You don't go to the gym once, and I say this in the clinic a lot. So you're expecting to go to the gym once, and then you go like, ta-da, I'm now all thin and rippled. Great. Or oh no, it's not like that. No, I know you have to go a lot of times. So, and then when you do go a lot of times and you go to the gym and now you have all the muscle and everything, do you then stop going because you've achieved what you wanted so you can then stop going?
Well,
It doesn't work that way, not even with medication, right? You don't take, your head hurts, you don't take a painkiller and like 2 seconds later you go, yeah, that's it, my headache is gone now. It takes time. Now, what do you consider time, and especially for a lot of the cases we're here talking about, some, this is from my own experience in the clinic, it's age related in the sense that these, a lot of the times they're in their late 30s and they might be trying for their first, or even if it's the second time, and they're just being told by a lot of people that, oh, it's just age and you're over 35 now, or you're almost 40, and that scares people, right? And that just adds to the stress, and it adds to more hormones, and it adds to more things. When you're under stress, you don't want to, you're not thinking about reproducing.
it's not.
That's not how we work, right? So there's a lot of that kind of getting the person back to, as I said a while back, about, going for their acupuncture treatment and saying, this is time for you. Tell me about you and tell me about how you feel and what do you want to achieve, and make it real, because everything will take time. And just like with the painkiller, I was thinking about it today because sometimes these questions come up and I was like, I want to have a good example to make sure I'm making sense. But a lot of the times we had this thing about, oh, I went for acupuncture once and it didn't work. Okay, so if you had a pain in your back and you took a painkiller yesterday and it worked for a while, but then today the pain is back, do you say that that painkiller didn't work? Or did you say that you just didn't take enough, or you need to take more of it, or you need to keep taking it? These are the expectations as well. And I really like that engagement with the patients as well, to really bring it back and making it real, to say, where are we going with this? Like you're talking about the hair, like I find hair and skin really difficult to treat in the clinic. One of the examples would be, so, and it's not even to do with acupuncture. So if you're thinking about skin, someone who would have skin that would be bothering them, you can imagine that they're using makeup, that they're using some way to disguise it in some way so that they're not as self-conscious as they are from it being with other people, right? Ideally, you would want to say to someone, yeah, I can help you with that. Just make sure you don't wear any products for like a month or two. They're not going to be able to do that. That's not realistic, right? So it's this engagement with the patient that I'm really passionate about and that I like, is to make it real and what would work for you.
Yeah, and I think, with what you mentioned, but also with PCOS in general, like I always talk about this, that it's a lifelong condition. So whatever lifestyle is helping you manage your symptoms, you have to continue that for
Yeah,
life. Or, if you have events that come up, that cause a lot of stress, then yeah, you might see more of your PCOS symptoms during those times. And yeah, so
yeah.
definitely with acupuncture or anything with PCOS, it takes time and maintenance and consistency and sustainability for sure.
But it's important to work with your expectations, right? Like,
Yeah,
that needs to be there and upfront, and it's almost like for you, from the patient's perspective, also to take that leadership in terms of the treatment as well, and saying, yes, I can do this, or actually being realistic and say, I won't be able to do this just right now, but I'll make sure that as soon as possible, I can arrange things in a way that I'll be able to do it. Here's the thing. I don't want someone rushing to come to my clinic because they heard that acupuncture is really, really good, but they have to leave work and they have to get the bus to get to the, that's no good to them, right?
it's true.
So it needs to be really, really appropriate for them. I have one example that I had a good laugh about this when I said it on camera, because last year, the year before, but in the clinic, I call it the chocolate cake paradox, which is, you have the slice of chocolate cake and you just feel super guilty because you shouldn't be eating it, but
Mhm.
you're going to eat it anyway, but you're going to feel super guilty and you're going to feel really bad and you don't enjoy it at all.
Right.
So then after that, what do? Do you have another slice, which is the one that you enjoy? Or do you just have the one and say, yeah, okay, I shouldn't be doing this, but I am doing it and I'm going to enjoy it now.
Yeah.
You're
So
going to have it anyway.
exactly, you're gonna have it anyways.
Yeah.
Well, we talked a lot about the benefits of acupuncture, but is there a chance like there's side effects or any, like, could it worsen symptoms of PCOS in some people? Like anything to be aware of, negative?